Oh, it's so good to talk to you again. We should have those by the time you see this one. I think you'll have the eyes up, or I'll have him put this one up first, and then the eyes are follow them. We've been so busy and short-handed that Chris been behind getting these up for you, so apologize for that. But a lot going on, a lot of people hurting out there. So I'm so happy for all you beautiful souls that are moving into the healing profession. It is a perfect place for all you spiritually more awakened people. Just a healing is a worthy profession. I generally don't go over the little stuff, but I think I've got a couple of requests from Ella. Ella, you wrote me an awful lot to go over on YouTube. Generally, these small questions like this can be dealt with our staff or, looking up books and stuff. But I've thought about this and I thought, well, I'll do this one time. I'll go over some of these questions that really, when you get into something like this, I highly recommend that you go out and you get all of Arnold Ehret's books. They're only $4 or $5 a piece. Small books on the mucus diet healing system, because when he started detoxifying people, all he saw was lots of mucus coming out of people. And then he realized that mucus was at the core of most people's problems. Well, I don't know how much he knew about the lymph system back then. That's early 1900s. But then as you progress and you realize the lymphatic system is the dominant system of the human body, the sewer system, you realize what that mucus is. And you learn about the mucosa that lines everything in the body and how it's responsive to proteins or acids as a protective device. And you start realizing why we have so much mucus. And that's because we're eating foods that are irritating the mucosa, foods that the body deems no. And that's meats, that's sugars even, complex sugars like pastries and stuff. Dairy proteins obviously are the most. They should be terminated off the planet. These are causing people the most serious problems in the lymphatic system. So it's just things we as a race need to address and get away from the financial side of that, no matter what. Understand that survival of the species comes first. I mean, it's hard to talk in that level when you understand some of the other levels. It's hard to, because this is just the drama. This is where the movies are played out, where you learn to control your mind and the mind and emotional part of God, and then you get to have fun in your own worlds, and everything you'll find comes out of your beingness. And so it's interesting, all this, hard to explain really for some, and for some it's woo. Anyway, I wanted to go over as much as I can. I only have about 45 minutes and about a half hour this morning. So I wanted to go over as fast as I could, so I apologize if I'm going too fast. But we have so much to cover here. Did you see the comment from Patricia about her dog, rectal fistula? And sent some nice pictures. I think she put this up on YouTube, but to show you how you can heal tumors and things like this in animals and stuff. Good job, Patricia. You guys did a very good job on your dog, and now you have a nice dog back. And you keep going. You can make your animals as healthy as you can get them. And the human, man, he's got a long way to go to get healthy. Some of these animals, you can get them healthy pretty quick. I've seen some incredible work on dogs where you take an old dog with cataracts and everything and turn them completely around and make them youthful again. That's cool. And that's really what you're doing to yourself. Okay, so I'm going to go down through here. This is Amelium, and let's see, it's shimmering 8-inch worm. Cute. Ate one the other day. Actually, I think yesterday I talked to someone that definitely got about a 13-inch roundworm out. I've got one here, but he's pretty dehydrated. Where are you at there, buddy? Come over here to Daddy. I don't know if you can see him or not, but he was alive when we got him out. And he came out alive out of a raw foodist She didn't want to do herbs, and I'm thinking, you don't want to do herbs, and that baby's alive? You know, someone just got threw up a bunch of these worms. I don't know if you can see them from the camera there. But, you know, nice little things that grow in the human terrain. All right, so now let's look at this. I hope there is a possibility to help this lady. She is 64 years old and 100 pounds. And you're going to see this, guys, all over the place, all these thin people, because remember, we've been talking a lot about gut tissue. That's the GI tract. That's the mouth all the way to the butt. All of that is your digestive tract, no question. Some of it you bring air in, but most of it's digestive tract. That's how you bring in nutrition, of course, to the cells and eliminate the byproducts of digestion, no question. Remember, most of our conversation deals with cellular waste. After the nutrition from digestion is absorbed, traveled to the big chemical factory, the liver, and then sent to get a little oxygen added to it, and then off to the cells, then all the waste from the byproducts of cell metabolism and respiration and the like are eliminated after the cells use this chemistry, and then how's that gotten rid of? And medical doctors think blood is the end-all, serve-all, and that's just insane thinking. The lymphatic system is the body's sewer system / main immune system / blood dumper. Blood dumps what it doesn't want into that system. I mean, this system is essential that people know, because if you don't know about your sewer system, the great lymphatic system, you haven't a clue why you're suffering, why there's pain, why there's swelling, why there's edema, why there's cancer, why there's any of these what medical doctors ridiculously call diseases. Why do we have these symptoms? What's going on at the cellular level? So what we're seeing with gut tissue now, so you remember gut cancer was #1, colon particularly #1 for generations, and so you have to realize how bad our GI tracts are. So that's going to take, man, generations to redo the bowels, no question. This is a big part of digestive system there that's been beat up real bad with the high protein diets. And I might add that the lymphatic system in the gut wall has gotten beat up, of course, back to the kidneys again. And now we coined the word interstitial, meaning around the cells, lymphatic, meaning the lymph system, constipation, meaning that lymph system isn't moving. It isn't moving well at all. And so when you have a system that's supposed to move waste away, and that system gets backed up, just like any sewer system in a house, that's what everybody's feeling. Not the blood, the sewer system. And since that system, again, deals with acids, then that's why you see the necroticides, the breakdown, the destruction of the human body, and the dehydration and coagulation of the fluids. Now, 100 pounds, this person obviously isn't absorbing well. So the first thing you're going to do on anybody, no matter who it is, 1 month old to 64 years old, you're going into that gut. You're going after that gut. Well, most of our problems, of course, lie in the lymphatic system, so we're going after that one too. Well, that one takes us over to the kidneys and the skin. And so the skin, we want to make sure you're sweating. If you're not sweating, look at your thyroid, because your basal temperatures under your arm is probably below, say, 97, 97.1. You're not going to sweat well below 97 in the 96s. And tons of people are walking around in the 96s basals and the 95s. So this is unfortunate, because subcutaneously, meaning just right under this epidermis dermis, you're going to find some coagulation or buildup of sewage, and that's those of you that have all the acne and the psoriasis and all of the any skin issue, actually, even all the way to the melanomas, all the way to the basals and squamous and stuff like this. This is just a buildup of acids subcutaneously. And this happens quite frequently with those with lower thyroid functions. And then when you add that to the systemic backing up because of the kidneys, you've got a closed house with a lot of inflammation. And that's for those that are hurting with the lupuses and the fibromyalgias and the sclerodermas and the things like this. Bad stuff. And so this is why it's so important. So with this lady too, you're going to get in. What kills us is the kidney failure. Number one failure that kills us all is kidneys. And that's why kidneys are a huge, huge deal. And you should always make the kidneys and adrenal glands top priority no matter what you do. No matter what. So the first thing you always do, no matter who it is, your friend, yourself, your loved ones, or your children, go after those kidneys, the adrenals. Or we could lump those adrenals in with that whole system, the endocrine gland system. Vital to get your glands back online, since the glands in your body literally control everything. You have organs and you have glands. Organs are like kidneys and hearts and livers. Glands are like the adrenals, the thyroid, the parathyroid, the pituitary, the pineal, the thymus, all these, the ovaries, the testes. This is how we get our hormones, our steroids, our neurotransmitters, our enzymes. All of these glands are essential to be up. Well, what shuts everybody down? And that's going back again to the kidneys and also to the colon, because when everything starts backing up, literally everything backs up. Nutrition isn't absorbed. Acidosis grows. It just keeps going and going. Swelling, stiffness, tightness, all this stuff keeps growing. And so this is why. And it doesn't matter who these people are. She is confined to her house, and if the neighbors spray chemicals, she has to leave the house in a car and go park somewhere. Well, here's another problem. That's obviously the first clue. This lady's adrenals are so far down, her kidneys are down, her lymph system is super clogged. She's extremely chemicalized, and this is a big problem here with this. I was just talking to one of the YouTubers, and she was mentioning she got some liquid bentonite, and it's really helping her with the heavy metals. And this is probably a good idea, especially you got to realize that this is gut stuff, but detoxification is the key to getting rid of heavy metals and neurotoxins. Two types of toxins we categorize, maybe more obviously, but neurotoxins are obviously what that indicates. Neural, meaning it shuts down the nervous system. You get short of breath around those. It shuts you down. The excitotoxins are more like the cancer-causing. I'm gonna break down a cell toxin. These are all acids, of course, predominantly, and so all your neurotoxins are things like pesticides, herbicides, quinine, arsenic. There's a whole list of them. So detoxification is the only answer, because detoxification is cleaning of the human body. And if somebody thinks that cleaning the human body out is ridiculous, then maybe you're on the wrong channel, because you really have to clean your human body out, just like you clean your car out. Except that we're much more sensitive to toxins than your car is. But I guarantee your motor will break down if it builds up with acids in it. That's why you never block off your exhaust pipe, and so the same thing is true in the human body. You never want to stop or block or in any way inhibit the flow of acid removal out of the human body, because that's not fun when you don't, and that's what tears these people down like this. She cannot eat many things, including lemons. Well, because she gets to the point where when you start, everything starts moving. Lemons particularly are very aggressive. She's got to find her a fruit. Well, actually, I'll tell you, it's probably better if she does some green juices for a while. Pump some greens, get alfalfa, get some kelp in there. You can do the spinaches, of course. Lots of parsley. If you want to throw cilantro, okay. And beets, lots of beets. And really fill up a robust green drink. I'd highly recommend that at least 2 or 3 times a day. On top of that, you could have 1 salad a day, and then I would find the fruits, berries, and melons that she can deal with and get the body detoxified. Get up on your kidney formulas. Get up on your lymphatic formulas. Hit your glands, because it's obvious that her bowels are in trouble, her kidneys and adrenals are in trouble, and she's not eliminating these toxins out of the air. So she's probably toxic, full. She's my sweetheart's mom, and this is what she sent me to send to you. First of all, my mother has dealt with numerous health problems throughout her life. Some of this could possibly be due to industrial chemical exposure. Obvious. Because when she gets around chemicals, she starts having a response. So she's loaded. She's full. It's like when you're allergic to something, there's a component to that your body has too much in there. Your lymph system's backed up. And so cleaning your lymph system gets rid of the allergies, of course. It's not something that you have to work with the rest of your life and take steroids and things. This is the kind of approach that we have to get away from. The medical approach to these things have to be terminated. Someone told me made some comment about the medical books, and I thought we should get rid of all the medical books. No, but we need to change our perspective, because at the approach of the medical community, the death toll from humans from the practice of allopathy is outrageous, and the fact that what do you want to call it, the judicial branch of our government is as brainwashed and as stupid as everyone else. I mean, we're allowing the FDA to allow drugs that kill all these people? For the sake of what, FDA? I don't get what you're talking about. The sake of helping people with that drug. Say a drug kills, that's given to 1 million people, and let's say 100, 200,000 get killed. Another 200,000 are severely maimed, and it might help a few. With what? To treat inflammation, like Enbrel, knowing that's such a bad drug. That floors me that we're at that level of kind. The human is something else. Now, after 30 years ago, she was diagnosed with a rare and aggressive form of cancer and underwent extreme and experimental chemotherapy. Well, I wonder what her problem is. I mean, you guys, you got to wake up. And you got to ring the bell. You got to be like the guy that takes off Paul Revere and ring the bell. Stop this in chemotherapy, and you legal people start charging these allopaths with crimes of manslaughter, because the use of chemo is barbaric, it's killing, it's unbelievable. And this lady suffered from the use of aggressive experimental chemotherapy. I knew one, and I told you this, one experimental chemotherapy group. The guy was thin like this from taking the chemos, of course, and chewing his body up. Well, he came in here, and 432 people in this experimental group of chemotherapy. Well, they all died, but guess who? Exactly. He's still alive and well and cancer-free. Well, he learned detoxification. He learned what cancer really is and the hype that's been brought out by the allopathic community. And what you have to do. Because when you start seeing cancer cells, you're in trouble lymphatically, aren't you? Why? Acids. And to take more acids that are hotter than that by far, I mean, this is insane. So this lady's suffering from not just industrial pollution, allopathic pollution, but at the worst kind, because very few acids in the air are at about 1.5 to 2 pH, which is most chemo. You don't see that much. That's hydrochloric acid and hotter. That's between hydrochloric acid and battery acid. I wish these judges would wake up and start slamming these people in jail. You know, because when you wake up to this, you're in trouble. And for the very, very few, 6% that survive up to 5 years for the mass slaughter of the human race is not something that's even intellectual. It's not something that's civilized. It's not something that's godly by any stretch of the imagination. This is negative. This is insultive. This is everything you can imagine. So we got to get out of that. And this lady's in trouble just from the chemo that she took years ago. You can't, for the sake of a few damaged cells from your lymph system not moving, and you're killing billions of them. I mean, that's insane. You know, if you're going to go back to life of the child in the womb, you better go back to the life of the cell. Period. You know. The treatment nearly killed her. No kidding. And she did survive the cancer. She underwent a hysterectomy and later got rid of her ovaries. The latter was performed by a careless surgeon, and there were many complications as a result. An attempt to correct the surgery was further butchered by the surgeon's attempt to remove the scar tissue from the abdomen. Well, I'll say this. It's not the surgeon's fault that she had scar tissue. I'll say that. That's not his fault or her fault. This is the body. What this is this person's body so acidic that when you start insulting tissue, the body has to put a lot more tissue there to strengthen it, because this lady has been so acidic so long that all these cells have lost their integrity. All the connective tissue has lost its integrity. And if she has a parathyroid weakness on top of this, then she's not going to be able to build that tissue back in the connective tissue, and you're going to scar, and you're going to get adhesions, little octopus things. And this is a serious problem. This is why surgery is important at one point, but you must then understand why the problem exists in the first place, that the surgeon, in his effort to help you, also created a lot of acidosis and destruction of tissue. Now, how does your body get rid of that? The lymphatic system. That's how your cells that are damaged go. They don't have to be cancer cells. All damaged cells got to go where? To the lymph nodes. Why to the lymph nodes? Macrophages, that's your immune cells that gobble up other cells. Bacteria is not gobbling up cells. They're after the acids. So getting this down is important to understand how the body works. And then you go, oh yeah, I see that. I understand that. It's simple. Even children can learn this and should be taught this, because we're in a world of trouble on this particular planet, and this is just one of millions of people that suffer like this lady. There's millions suffering like this. There's been a lot of destruction allopathically to this world for the sake of what? Diseases and, we're going to find something. That's all. This is so much hype between, I tell you what, when the people wake up to the Rockefellers and the world bankers, I don't think there's going to be a tree big enough. Of course, that's an old country boy saying. Okay. It goes on. So I don't know what the surgeon did that was bad, but I can say that adhesions are not a surgeon's problem. It's her body's problem. And these adhesions, she did get adhesions too. Scar tissue from the abdomen and, which resulted in more internal scarring and adhesions around the intestines. Yeah, this is not the surgeon's fault, guys. I mean, I'll beat up people where they need beat up. You can beat me where I need beat up. But this is one time I'm on the surgeon side. This is her body too acidic. Way too acidic, but you had to be that way to lose the uterus in the first place. So this is, in the sake of trying to help people, surgery, one has to wake up to acidosis and what that means to the body. And that's scar tissue, that's adhesions. But I can tell you, this can happen without surgery. Many surgeons that go in to remove uteruses find them welded to the intestinal wall. And that's because that's what acids do. They weld. I mean, you got to look at what's going on here in the human body here. She has issues with bowel mobility. She has a family history of colon cancer, but she also cannot have a colonoscopy. Well, you just got to get on the herbs, you got to get on the diet, and you got to find where you can move her through. And this is some of you practitioners now, you guys on YouTube, you're going to get cases where you're wiggling them through sometimes. Can't always just jump them on fruit. There's no question. Especially with so many chemicals, need some greens for a while. Bring them into a little more of a balance and then go down the road a little deeper. But to get this scar tissue and to get these adhesions backed up, especially after a surgeon goes in and cuts them back out, because you're going to hope you've got a good surgeon to go in and cut these adhesions back out, or they'll strangle your intestinal tract, as she probably already knows. Now, you got to understand that it's your mom that's holds the key, and that is she's got to get her body back into a base balance, more alkaline balance, hydrated, to where the body doesn't have to scar itself to protect itself. And that's just what's going on here. This is all about systemic acidosis and what the body has to do to correct that. That's all this is. The chemotherapy, on the other hand, bad move by medical doctors. That wasn't a surgeon that gave them that, though. About 12 years ago, she began to have symptoms of what we now know was extreme allergies, asthma, and chemical sensitivity. Well, I mean, she's been on chemotherapy. She probably is near some industrial pollution. The allergies is just her lymph system, which has never been addressed here. Her asthma, of course, is just the adrenals telling you that the nervous system's down, and her breathing is compromised. If she has congestion in there, she's full of mucus on top of that. At this time, these were diagnosed as chronic sinus infection because of a sinus inflammation. Well, guess what? Honey, your mom's backed up top of the head down to the toe, lymphatically speaking, so she's full of mucus. So you have to detoxify your mom and get her going on this, or she can't come out of this. I mean, she'll just continue to acidify away, if I can say that. Increasingly high dosages of antibiotics were prescribed by the time, I mean, this is the This is why all are past. You medical doctors, if you're listening to this, come aboard. You just got to get away from your modality before it comes down. Remember karma. Remember the whip of the dragon's tail. And that's what's coming toward the medical doctors. So you guys get out now and come over to my side and we'll heal up the world. And I'll show you how to do it. Because right now, what's going on medically is insane. And people are learning and growing. And the use of antibiotics is ridiculous. You got to go to the herbal antibiotics if you're after that, because it's selective kill, and it's not the bacteria that's a problem, it's the acidosis. Relearn this. Get away from antiquated biochemistry theories, and let's look at clinical work, what's going on and what's happening. That's where the truth is. That's where the reality is what you can do with your clients or patients. Not what some lab thinks, not what some book thinks, what some theory of biochemistry thinks. What's actuality? Remember, we watch plenty of soap operas on TV. That's medical thinking. Get into the actuality. People are watching Swamp Men, Buggy Men, you know, Honey Boo Boo. This is what's going on in the real world. Well, you need to know what's going on clinically in the real world of how you get people well. She was already suffering the side effects of the high doses of antibiotics, no kidding. And then without that bacteria, of course, her lymph system just continues to get worse. She had numerous digestive issues and severe reflux. The acid reflux has caused damage to the esophagus. Well, let me say this. It's probably a lot more right now than acid reflux. It's probably the worst kind of acid reflux, my dear, and that is burning from inside the wall out. And that's an acid burn that you can't get by just putting aloe vera and different herbs down like comfreys and slippery elms and marshmallows. This burn's coming from inside the wall. And what's inside the wall of the esophagus? The cells and the two fluids, the blood, the lymph, and the cells that they feed and clean. And until you move her lymph system, she's going to have some serious problems, because with the chemo on top of all this, she runs the risk of having lots of cancer in her if she doesn't already. But don't freak out with the word cancer. Understand that it's damaged cells. What's damaging your cells in your body? Same thing that's causing the scar tissue, the adhesions, acidosis. And you have to address this. Her problem's in her kidneys and adrenal glands. Everybody's cutting everything else away, but the real problem's in her kidneys and adrenals, and you have to deal with that and get this done and clean up her bowels. Because what brings down the bowels just as much as high-protein diets is interstitial lymphatic constipation. Oh, this letter's going to take this whole thing, I think. Including multiple strictures and gastric mucosa. Well, you're burning. She's burning up. She chose to go down the acid road, and that road's just frying her up like a piece of chicken. And so she's just got to get away from that, or there's no coming back out of this. There's no magic out there, guys. That's why this is so important. You guys are so good. I can't believe it. I keep talking to you YouTubers, and you're writing your own protocols, and I'm amazed at how good you guys are. You're going to make some of the world's finest healers. And I tell you, don't let anybody bring you down. Don't let anybody steal your joy. You guys don't have to have college educations. The world of healing is simple. Jesus taught that, Buddha taught that, all these spiritual giants taught that, but people just ignored them. They like the complex. They like the intellectualism. It sounds good. Sounds good. But in practice and reality, it's complex, and it takes you away from the simplicity of healing. And you see that in allopathy. So we need to all get simplistic and stop the roar of intellectualism for a while and get ourselves balanced within that and the mind and yourself, the soul. You must get a hold of the mind. Overpraising of the mind builds narcissism, and if you haven't noticed, this world is literally crammed full of narcissistic individuals. Unbelievable. She is on proton pump inhibitors now in order to keep her acid reflux under control, yada, yada, yada. Also, because most of the natural bacteria flora has, no kidding, been killed, yeast was allowed to grow unchecked. Well, you know, this girl gets it, obviously, Amelia, and she understands what's going on here. Over the years, her chemical sensitivities have become more, oh, no kidding. Well, she's on her way to death, guys. This lady's on her way to death at 64 years old. And then if her adrenals are down so much, she's going to have a lot of cholesterol problems and everything else there. And then calcium's going to be sucked right out of her. So, you know, this is just what you're seeing here. Both are swallowed and the ability to absorb. Well, here's the thing. If she gets too bad with swallowing, you got to get a feeding tube in her. You really got to get a feeding tube in her and start going food into her stomach. But you've got to detoxify this lady. And I do the greens and green drinks with this one and go down that road, okay? I only have a few minutes left, and I apologize so much. And forget my ranting and raving, but boy, I'll tell you, you know, this is just one case after another case after another case, and that's all we get in here are these cases. So you have to understand our position here is we're God people. We don't want to see you guys hurting. We love people. We don't want to see people hurting and suffering. But when we get this constantly, it kind of gets us a little upset at who's doing all this or who's helped to promote this. It's no question that each and every one of us create our own road. No question about it. But we do it with such ignorance. And the problem is, we're at the 21st century on this particular planet, or what they call anyway, and we call ourselves civilized. This is a very uncivilized planet. It's a very aggressive planet. It's a very warring planet. And I mean, we still have our heads buried in the sand a great deal. All you guys that are awakening, you're as soul, you're awakening to yourself again. You're coming up out of this dream, out of this drama. And thank God, because we need all you beautiful souls there to come and help the world. And if that's not your gig, okay, you know. But to give, you must allow yourself. You must get yourself and get the love and merge into God and become the love principle. And I'm still doing the video on love. I just need to be in the right mood and not be in a hurry here to get some messages to you. So. I'm sorry with this one. There's so many questions. What a beautiful young girl. And her mother. Now, Mom, you're asking me a lot of questions that you can take care of by reading books and stuff, but I'll tell you what. I think that, as I said, after going over these, I think it's important that I address some of these. So forgive me if I go a little fast. I only have about 5 minutes. So thank you so much, though, and I appreciate these questions. Call Shannon or one of the people out front and help you with some of these questions. But she's a 38-year-old. She was always very conscious, obsessed about health. Excellent. Since she was 13. So this is a higher thinker right here, or a higher aware soul right here. At that time, back in Lithuania, there was not so many options in books, and I believe that. Comparing to these, and that's the way it was when I came into the raw. I could only find them at natural hygienic fasting clinics or through health research. Those are the two places that I could only find raw books or spiritual books. Tried and went all the different directions possible. 15 years, vegetarian, water fasting, sports, all kinds of vitamin supplements. No kidding, me too. But at the same time was consuming lots of sweets and wheat. But nothing helped me with my constant fatigue and depression. Now, constant fatigue and depression. So we have two things automatically we want to take a look at. She has children, so we find about postpartum depression. Then you say, hey, wait a minute, parathyroid, calcium utilization, depression. Oh, wait a minute, what about fatigue? Could be thyroid, but where's the better side? Definitely adrenals. So here we go. We see adrenals and possibly parathyroid all together here. After my daughter came to this life, I am having sleep problems. Well, you probably have a lot going on lymphatically in the head, sweetheart. Also, I am getting skin conditions from time to time. So again, we're seeing the building up of the lymph system. We're still seeing the buildup of acidosis. We're seeing the buildup of the lymph interstitially and subcutaneously, right under the skin. So here's what we're seeing, this slow buildup. As long as I remember myself, I've had low energy. So at her age anyway, at 38, she's got kidney and adrenals. You know that hands down. What if you're wrong? You can't hurt her because you're gonna make her healthy. You can't hurt someone when you're making them healthy. I mean, hello, what a beautiful modality. Hey, the sun's up, the sky's blue, the weather's warm, and the water's fine. Come on in. And that's what this is about. Uniting the healing professions on this planet is what we want to do. We all unite and focus. We can clean up a lot of messes. Ooh, that wouldn't be good for the World Health Organization or the World Bank, though. That's a problem. What are we going to do about those guys? Big tree limb? Also, I am getting skin problems, as long as I remember, sometimes till that point that saying a sentence seems too energy consuming. Wow. So that's really neurologically weak. So here's the thing. Again, you got to detoxify yourself, sweetheart. Get in there. Get into the kidneys. Pop up those adrenals. This is a case where you're probably going to want to use a glandular. I can tell you right now, because at 38, she's been tired. Or way back at 13, she's so tired she can't talk. That's the autonomic nervous system. Probably some stuff going back at the cerebellum, the stomach area. Remember how that autonomic nervous system works with the parasympathetic, sympathetic. Sometimes more energetic times in my life. It was because I was okay. I'm also tried looking for answers. Of course, food is very important, but isn't there is more to life than that? Well, you know what? One of my supreme points is why do we spend so much time arguing and dealing about health? It's simple, and once you get this, guys, you just go down the road. And that's what I'm saying. So many of you YouTubers are doing so well, and even putting their own herbals up. I'm amazed. Protocols is everything to how you get your clients well. And this level 2 is going to be a lot of protocols. So it's learning how you take these clients and work them back from Hellville to Wellville. And that's just exactly what this poor lady needs, and it's what this other lady needs. It's what everybody needs. But we've been walking down wrong roads. It's time we bring into some proper roads. But then again, you know, karma has to be worked out, blah, 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 blah. Now, look, she's a massage therapist. Yeah, well, learn neural lymphatic points, number 1, down the bottom. I put them up on a video for you. All massage therapists need to learn neural lymphatic points. You'll find so much better at kneading. You'll find so much better lymph drainage, especially in your second and third sessions. You're going to really find a lot better things going on. Oh, she's good. Look, I just ordered your herbal formula. She's on the adrenals, lymphatic 1, thyroid, kidney, upper circ, brain, and nerve. While waiting, good choices. I am on high fruit. I hope grapefruits are fine too. Yada. And taking lots of herbal teas that are responsible. There you go, sweetheart. Alfalfa, skullcap, fenugreek, coriander, horsetail, dandelion, nettle, red clover, licorice. Woo, woo, woo. Now you're walking down the road. Now, those are all great herbs. I love the skullcap. Oh, great neurologically. Alfalfa, the power hog, not wheatgrass, alfalfa. Power hog, horsetail, dandelion, the universal, incredible, high A's, high calcium, nettle, major kidney, red clover, incredible blood, liver, lymphatics, licorice, great adrenals, great anti-inflammatories, a lot of loose herbs. Yeah, enjoy that, sweetheart. I have strong cravings for bread. Well, you know, just what you said earlier. High yeast problems, high fungal problems. Use Parasite M or something like that to do a kill with that. At the same time, fix your adrenals because that's sugar metabolism. And you're continuing to have fungal problems as long as you're not metabolizing your sugars properly. Nature can't keep it out. All right? So I ordered Parasites, a bowel formulas. Smart. Let me tell you that I always was a bit fruit lover. Yeah. You notice the spiritual people are fruit lovers. Why? Because that's the nectar of the gods. You don't see gods down digging potatoes out of the ground, picking. Ah, baby. Yeah, that's a Homo sapien. I'm going to have to finish this up. My appointment's here, and I got to finish this up. I'm sorry, I'll come back to this and finish this letter. My daughter's a year and a half, generally healthy, but I want you to realize, like mom, like dad, like kids, and so, no question, she's going to have major kidney and adrenal weaknesses, sweetheart, and it means her autonomic's probably down too, and that's the autonomic nervous system. So, stay away from the vaccines and the neurotoxins with this child, and build her up. Go real slow, couple drops of the brain and nerve 2, couple drops of endocrine gland, couple drops of kidney, couple drops of lymphatic 1. Coconut milk, perfect. I was breastfeeding till she was 1. Then she went on cow's milk. Oh, yeah. Oh, yeah. No, yeah. No, 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 no. So I'll finish this up when I could steal some time. So I'll come right back. Hold your thought. I love you guys. You're getting it. I'm so proud of all of you guys. We're making a difference, guys, and I'm telling you, the journeys you guys are going on spiritually, you're keeping me busy. I love you all. I'll see you after a bit. Bye. Good morning, everyone. How are we doing today? I hope good. You guys are, some of you are kicking butt and some of you are struggling. Listen, I know struggling is tough. I know getting well sometimes for some of you has been a booger bear. I mean, we just talked to a young lad who's really doing well, but he's been months and months and months, and just now is his kidney starting to filter. And we were talking, and him growing up, his was so tired, and his blood pressure used to be like 85. So I mean that, or 95, and those are real low blood pressures. And so you're seeing a lot of that out there. So just remember that the adrenals and kidney is your connection. And whether you realize it or not, fix those up and get those filtering. And it's incredible. Remember, fill the boot. In this words, fill the cup. Remember that one? That's a lot of sediment. Fill the boot. I want to get to some of your questions and everything. I know you've been patient with me, and I really thank you for that. Even though there's so much, I'm trying to throw as much out to help everyone with some of these cases, because even though each case might not be relative to your case, it is relative to your case, because really if you start to look at the simplicity of this whole thing, you start to realize cells and two fluids, cells and two fluids. And you start to realize two sides of chemistry, acid, base. And then you start looking at this and understanding more why you have pain, why you have swelling. Location, location, location. So let's start some of these questions, because you guys are asking some very good questions, and there's some of you that are suffering pretty bad here that's coming online now. So let's everybody help everybody. I've had incredible feedback on the Facebook sites, guys. You guys are tearing it up. Always give that love and healer out. We'll be talking about that at the class. The class is the path of the healer. And so it'll help you to understand everything involved in being a true healer. And this really affects the healer themselves. So let's go look at this. This is a GVLOAN guy. GV Lone Guy. Ooh, musician? Oh yeah, man, I see. Look, Black Sabbath update April 1st, 2003. But 2, I'm going after a new, I forgot to mention something. I don't know, there must be conversation going on here, my friend. I have stage 4 melanoma, which has recently gotten very aggressive. It's in my lymph system and spreading subcutaneous lymphs all over. Now, first of all, realize, my friend, that this is the lymph system. It didn't get into, it is the lymph system that's causing this. It didn't get into the lymph system. The lymph system is the system of melanomas and lymphomas. They're all the same. You know, this is about acids, and it doesn't matter what cells they break down to give you the type of cancer they're going to call it. It doesn't really matter. It doesn't matter what location, because really when you have melanoma up here, you've got it all over, lymphatically speaking, everywhere, in the liver and everything. So we use the word metastasizing when you're talking about cancer, finding it in multiple places. In reality, that's not a true word. It is that you're systemically involved. And a lot of you that come here, and a lot of you that's been involved in this, begin to understand that when your sewer system's backed up, it's backed up all through you. You might not feel different places. You might see expressions on the neck or expressions anywhere on the body and not realize you could have multiple tumors in the body, multiple cancer sites already, because an allopath hasn't pulled a cell and had it stained to tell you you have cancer in different places. You just have to remember that. Don't fear the word cancer. Bad name, bad image, bad concepts. Everything about the word is set up for you guys to feel that it's a disease. You can contribute money to this. Get real. Get with what truth is. This is a lymphatic problem, and this poor gentleman here is fighting his lymph system. Look, he's balding up here at the top. If this is him, his hair's like mine. Lymph, 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 lymph. Can speak from that myself. And of course the lymph nodes are going to be highly involved, because your channel from the cell to the lymph nodes. Now when the lymph nodes are backed up, then the cell gets backed up, and that's called, to me, cellular constipation. Cellular constipation is a lot worse than, say, constipation through the bowels, because this means cellular constipation of a very acidic level, and that's problematic. When you have constipation and you have hydrochloric acid involved, it's generally neutralized by bicarbonate. If it isn't, you're going to burn, and burn, baby, burn, and that's what's going on here. subcutaneous lumps all over my chest, abdomen. That shows you that you're very systemically involved, my friend. Get your adrenals and kidneys moving yesterday. I see that you're using some black salve to pull them, but let me say that you open up a port here somewhere and that body will keep it open on you. You can do the pulling, but you want to get that kidney channel opened up aggressively. Go after that kidney and adrenal glands and get on some lymph formulas and aggressively get into this. Along with the ones on my face, see video. I need your help in understanding a contradiction in my understanding. As a cancer patient, I'm told to avoid sugar since cancer loves sugar. Well, I'll say this, and I'll be this bold. I don't know what to call you. GV? Listen, GB, if you want to live, you forget what you think you know about allopathy and get on detoxifying the body if you want to live. Because right now, with the cancer all through you, I'll be straight with you, there's nothing they can do. You know that already. I'm sure they told you that. And there's nothing they can do. There's nothing they can do in the first place. And to do chemo or anything on top of this is just going to make you have an early life in another area. So you really want to get with understanding your lymph system. Our twist on it, of course, is adrenals and kidneys. Their twist, they don't have a twist. And that's the problem. So you don't want to treat this as a disease or you'll not make it. You want to focus on it, the reality of this, the reality of the side of chemistry, the reality of what system you're dealing with, and the reality how the kidneys and adrenals control that system. Allopath hasn't got there yet. They're still back. They're still back 50 years or more. We're always progressive. We've always known that. Well, in the last 30 years anyway. So forget the sugar. Remember, and I went over this over and over again. You see it on the videos here, and you'll see it on my website. So I don't want to keep laundering that sort of thing, but you got to get away from that concept about sugar, because we use word sugar like we use protein. We throw these words out: fats, sugars, proteins, but that's not a definable substance. That's like a word that's collective. And doesn't mean, doesn't give you an understanding of sugars or proteins as far as that matter. Matter of fact, if you want, I'll tell you this. If you were facing a sugar consumption or proteins consumption as a cancer patient, if you go protein, you're done. If you go sugar, at least you'll live a lot longer. Now let's break that down to amino acids and simple sugars. Simple sugars is required by every cell. You cannot starve a cancer cell because that cell likes sugar. All cells like sugar. But you can't starve a cancer cell for sugar without starving the rest of your cells. You've got to get with this. Because at this point where you have lymph backed up all through you, what you're going to see is cells all through you and atypical. Right now, you probably have a lot of atypical cells, cells that are converting to cancer cells as they're being mutated by their own acid waste. Intracellular acidosis. And this is, until then, it's simply inflammation on the outside of a cell. We call that inflammation. Acidosis is a far better word in understanding the reality of what's going on with you. So you're really in a race to open that up. Subcutaneously, if you're backed up that much, that tells me you probably have a thyroid weakness as well, and you're not able to sweat. I would get myself a sweating, open all the doors, open the kidneys, open the bowels, open the skin, and really get that lymph moving at all costs, because you're highly involved all through you, lymphatically speaking, and no one probably helped you for years, my friend. So don't be conflicted, because if you waste too much time in confliction at this point, you're really involved. And you want to get your life back here as fast as you can. However, I think the sugar is on the acid side of things. Not really. Is there why cancer loves to consume sugar? No, not at all. Sugar is not on the acid side. Sugar is carbon. Carbon, oxygen, and hydrogen make up the predominance of fats and sugars, where your proteins have more nitrogen involved. That's more the acid side of chemistry, not the base side. Proteins are definitely not on the base side of chemistry. They're on the acid side of chemistry. And meat protein is necrotic protein, is sewage in itself. And when you eat a piece of meat, you're actually eating part sewage. So, there's urine in meat, there's all kinds. This is the waste product. So, you're eating blood that's been cooked and stagnant and putrefaction. I mean, you can go on and on and on. And if you think that's healthy, American Cancer Society, let me show you this. I've showed this before many times, but this is for you, GV. American Cancer Society. 1986. You see, that's all sugar. That's all sugar. Fruits, vegetables, all sugar. Wait a minute. That's the American Cancer Society. Now, what they recommend is high protein and high fat. Quick way to lose your life. Quick way to lose your life, because that's what most people have been eating when they're diagnosed with cancer. That's the diet they've been eating. So you want to turn this around and get yourself, get on these videos, my friend, and get yourself learned and get your life back, because you're in trouble here and you want to get that. I'm trying to alkalize my body to create a bad environment for cancer to live in. So I do. Well, you realize it's not a disease. It's living on its own. It's not a living, breathing entity that's inside of you that's attacking you. That's what medical doctors want you to think. And you got to get away from that kind of thinking, because that's not how it is at all. We've got acids, we got chemistry, we got physics that rule creation. This level of creation just happens to be a little more chemical than all the other realms out there. When you leave this physical world, you'll start to experience more magnetics, more energetics, more frequencies, less chemistry. This is the most mundane world we know of that's made of finite chemistry. And it's a tough world to be in. And you have to use chemistry to fight chemistry. This isn't an entity with its own consciousness. Disease isn't an entity with its own consciousness. And as soon as we learn that, we'll take a heavy burden off of ourselves, and we'll free ourselves from the addiction of allopathic medicine, which is doing nothing but killing most people. I had a medical doctor in, great soul, great spiritual soul from Canada, moving down here. And he came up the other day and he said, I just want to thank you. He said, my patients are getting cured. Finally, they're getting cured. He said, I'm in with 7 or 9 other physicians. And he said, I sit down and talk with them. He said, but they don't always listen. They're narrow-minded. And that's the problem. And this is also true of naturopaths. All of us get rid of our narrow-mindedness. Get rid of our belief systems. Forget about what you believe in. Seek truth. Seek what's going on. Because if you're treating your patients and they're not getting better and you're just controlling their symptoms, you're not a good doctor. The whole world needs cured. They need a remedy. Just like our federal judicial system, they're trying to remove all remedy for the private sector. So you don't, in this country, have remedy anymore. And they've done that in a lot of countries, removing the remedy of the private citizen. Yet the government wouldn't be there without the private citizen, because no matter what country you're in, it's we the people, always. So, hard lessons spiritually coming, that's for sure there. So I do green powders in my pea protein packs. I'll tell you, man, the more protein stuff you do, you're going to see this get more aggressive, and more aggressive, man. Got to change the way you think. Detox, detox, detox. This is a fluid problem right now that has created the cell problem. Get rid of the fluid problem and the cell problem will go away. That's simple. I've heard you say to alkalize my body, I should eat fruit, berries, and melons, which I love and crave, but try to limit because of the sugar. Change your mind, man. Change your mind. That's all I can tell you. Or, get yourself ready. This is C-A-I-T-L-I-N, day. Oh, nice. Hello there, Dr. Morris. Thank you, sweetheart, for your comments there. The reason for my message is I have a cousin named Mandy, 20 years old, who around the age of 12 started losing her vision. Holy crap. Look at that. 12 years old and you're starting to lose your eyesight. She's now completely blind. Oh my God, is she a diabetic? Let's see. Let me see. Things got worse, and with more tests and medications, her brain is actually shrinking, and the blindness was a factor for something much bigger. Now, what side of chemistry shrinks? Now, there is hypertrophy, enlargement, like hypertrophy of the prostate, enlarged prostate, and it is true. This is all about pHs. And early on, swelling becomes part of acidosis, no question. In advanced levels of acidosis, the shrinkage and the dehydration and the consumption of the cell itself, the death of the tissue. So this girl's highly acidic, same problem this other man has, differently experienced though. And I tell you, this goes way back, way back, probably the minute she came out of her mom. And she just got her mom's lymph system here. Let me see. Her brain is shrinking. She's been diagnosed with something called Batten's disease. Batten's disease. Now, I looked that up because I'd never heard of that. And it's just all acidosis. I looked at that. They've got a long thing about this, how it affects the neural cells in the body and how it coagulates and all this stuff. Pattern is inherited as an autosomal receptive patterns. The mutation causes the buildup of fuscins in the body's tissues. These substances consist of fats and proteins. Oh, here's fats and proteins again. Uh-oh. How about that one? And form certain distinctive deposits that cause the symptoms that can be seen under an electron microscope. So it goes on and on and on, but I'll have to say this, it's like when we talk spirituality, we're talking about the one God, right? And so whether you're Muslim, whether you're Hindu or whatever, you might think you're separate than all of us, but you're not. And if you look at the Indian religions, you'll find that most of them see the world as one. And you'll see that in a lot of teachings there. And if you look through the agnostics of Christianity, you'll see the same thing. And Jesus talked about it. Buddha talked about it. Can't speak to Muhammad. But all the spiritual giants that I've studied have spoke about that. Well, you have to understand this is also true here in the health side of it. This all comes out of pH factors, which is simply the movement of electrical magnetic energy between two poles, forming chemistry. And you've got chemistry. So which side of chemistry is all this happening on? Then you can divide the body up into fluids and cells, because you have two major fluids of the human body and a bunch of cells. So then you can get into what fluids carry the acids, because it's the corrosive side of chemistry that you're seeing: brain shrinkage, blindness, the decay, macular degeneration, wrinkled retinas, all these things like that. You're seeing all these things from the acid side of chemistry. So you've just got to get in there and work on that and get that lymph system on this girl too. I would go after it. I would love this case because I believe that the chances of getting her sight back could be good. So you really want to look at this. It's just you have heavy cataracts over the eyes. What's going on here? So I'd like to really get into this case here, get this girl's vision back if you could. That would be exciting to me. You can definitely want to stop the shrinkage of the brain. You can stop all this, but what do you have to do to stop this? And what foods are electrical for the brain? What foods are brain foods? Berries, fruits, and melons. Those are brain foods. Those are neural foods. Problem is proteins and fats. Proteins and fats. That's always been the problem. Same thing for the guy here with the melanoma. Proteins and fats is the problem, not the remedy. They make you think it's the remedy. Well, what it does is dig your hole deeper. Makes good money for them, though. So you really want to go after this. She's been diagnosed with, let me see. I know the power of the raw diet. Absolutely. I can't pass on to her family. I understand how busy you are. Okay, no. I tell you what. This is New Brunswick, Canada. Oh, you betcha. I love these type of cases because this poor thing suffered so bad. You've got to get in there, clean up her bowels, get her kidneys, get her adrenals up, get up in that head, get in upper circulation, brain and nerve, get in there and turn on everything, get these acids out, stop the necroticizing or the degeneration of the brain tissue, refurbish the optic nerves and the central nervous system along with the ANS, and you could get her back. At least you will stop and rebuild brain tissue as much as you can. But I can tell you, we've got a lot of people that have had neural paralysis overcome it. You're about to see several more. We've got them working right now. Incredible work. And that goes to you, the young lad in the wheelchair, the paraplegic that's now walking. Doing real well. He's got leg braces, walking, he can move his legs in physical therapy now. This man is going to be walking, and that's what it takes. This man is determined, he's focused, and he's doing it. And that's what it takes, despite what you think. You got to drop, because it's like the guy here with melanoma. If you ride with typical thinking, your chances of passing are high, especially with this much cancer in you. Let's be real. If you follow traditional thinking, look at the stats. Look at the stats. And so if you think that thinking is appropriate, then look at the stats. And let me tell you, the stats reflect not much higher than 6% cure rate or what do you call that, in remission rate for 5 years. You don't want to be in remission rate, because that means you're just waiting for the 5 years to go and then you go down to 2%. I mean, that kind of thinking is just insanity to me. You really want to get into your body and get this fluid moving, my friend, or you just can't stop what's going to happen to you. And going to proteins and fat ways ain't going to get it. You got a fluid, you got to start filtering through your kidneys, and that's what it's all about. And your adrenals control that. And to some extent, probably the pituitary controls that. So you're really involved here, and you just got to get those kidneys opened up, or it's just a tough fight. Because you can't pull all this fluid out with black salve, man. You can't do it. You're too involved. And so you really got to get that filtration going, okay? Hey, Bo 37, I heard from you in a long time. Thanks, I'm glad I'm your favorite, Doc. Long time no write. Yeah. What are the best herbs to help with fertility? And this is a good question, because I see this a lot. Our problem is the opposite. Our female reproductive formula, I've said this to you before, the trouble is taking it while you're on birth control pills, because we've had 1 or 2 women conceive while they're on birth control pills, taking the female reproductive formula. That's how good it is. So, I mean, that's powerful. So it's enough to say, though, that if you're having problems with getting pregnant and conceiving, then you're going to work on your pituitary gland. You work with the female reproductive formula, you tone up the uterus and ovaries, but the real problem is probably pituitary, to tell you the truth. At the same time, you're doing this, you want to fix your kidneys and adrenals and all these other things, because you want a baby that's healthy. You don't want a baby that has your genes, because you can't conceive. That's an endocrine gland problem. Well, the endocrine glands are the bosses. These kids are already starving for endocrine gland health. And this is why we're seeing. Matter of fact, did you see on the news this morning another guy died from propofol surgery? Well, there is, I forget the percentage, someone out there might know the percentage of deaths that come from anesthesia in the first place. That's just, there is a percentage of deaths and surgery that's not surgeon oriented that is propofol caused. So there's a lot of that out there. It's probably 6% maybe, I don't know, but it's enough to say a lot of people don't make it off the table from the anesthesia. Why? Neurotoxic. And it's just what they were talking about on the radio, and they used the word neurotoxic, and I'm going, yeah, understand we have a world of a lot of neurotoxins. Pesticides and herbicides are neurotoxins, and yet they put them on the very food we eat. You know, and so they make us zombies, so then they can control us, take our money, and everything's good, right? So, Bo, go after your female reproductive formula, go after your pituitary a little bit there. Now, there's chaste tree in the female reproductive formula that is good for the pituitary. If you're having a lot of trouble, or your friend's having trouble with this, then definitely get on the pituitary glandular for a little bit. I'll say this, if you're having pituitary problems, fix your colon. Because remember, on the eyes, I keep showing you that transverse bowel, the relationship there. You know, what's funny is when we see healthy bowels, we don't see pituitary problems like that. Isn't that funny? I mean, you see that relationship. So everything is related to the one. Even the body, the cells, everything is related to the one. And when we get onto the love video, I'm going to try to make that a little more apparent, but it's coming. So thanks for the question, Bo. Let me see. Even after more than a year, I cannot clean up my skin. Now, here's another important one, Bo. Even after a year on this, she cannot clean up her skin. Still dermatitis on face and scalp, and now also eczema. Also anything specific I can try. I am really amazed that I cannot get my skin under control. I am amazed too, but I have seen this before. Now, I just talked to a guy that has been months, and he's just now seeing a little filtration in the kidneys. But his symptoms haven't gone away a lot, a little bit here, a little bit there, but not like he wants. And the reason, and he knows that he's not filtering. So the fact that we at least know this, guys, is a big step up. The other thing is working this. And I say, Bo, you're probably going to have to dig in. If I have a picture of your eyes, I thought I did. But you get, you know, it's lymphatic. It's just like this gentleman earlier, melanoma, subcutaneous. That's where the problem is in you too, Bo. Subcutaneous, right under this top layer of skin. You've got that lymph node bed, and you're tied to the subcutaneous. But you remember The skin is the body's third kidney. And when that kidney is overburdened and you start to see all these acid involvements on the skin, that's the first thing you got to know is, oh, my kidneys and adrenals aren't working right. That's the first thing, because when you get them working right, I promise you this is gone. So you really got to keep draining that lymph system. Get yourself, just like this guy, get yourself sweating. Open the doors, open, open, open. You go and get the GI broom, get into your bowels, clean those up really good, because you know there's got to be a bowel connection to that pituitary problem. And if you can't conceive, it's definitely a pituitary problem. At the same time, the female reproductive will tone the ovaries and tone the uterus. That's all good stuff. If you guys fall in love with herbs and what we can do with them, you'll be so happy, because it's their nectar of the gods. They're tools that don't hurt us like pharmaceuticals. They're the beauty of life. And never want to get upset with herbs and stuff. There's strong herbs out there, absolutely. But they love you. They're here to help you. They were designed that herbs have consciousness like any other plant. And they're here to help you. And they love to help you, especially when you say, come on in. Thanks, Bo. Appreciate it. Dig deeper. Go on some juice fast. Get into a 30, 40-day grape fast or lemonade fast. You know, keep pulling on that lymph. Definitely go after your kidneys and adrenals. Check your urine. Make sure you're filtering. You know, and just keep moving on that. Get your thyroid up, sweetheart. See if you're sweating. Check your basal temperatures under your arm and open this up. Try those neurolymphatic points down your back. Try to get yourself draining and opened up, honey, because that's all that it is. Your body is like this other man, just not wanting to give forth. And some people work almost a year like this and still can't clear up things. And it's just, I don't know all the situations, whether she's been able to do all raw, whether she's been able to fast enough, things like that. But I can tell you that if you don't see your symptoms going away, you're one, not filtering, or you're not digging deep enough, or your lymph has gotten so stagnant that it's gotten thick and it's just going to take a while to hydrate. Remember, the longer fluid is acidic, the more dehydrated that fluid gets. And the thicker it gets in the coagulation till it dries up. Just like that poor girl and her brain shrinking. That's acidosis. I mean, that's bad. That's bad. And we can refurbish, regenerate. And so that's what we want to do. Refurbish, regenerate, rebuild. And that's what this is about. Hey, Pa. Dr. Morris, my dad Thomas is age 84 years old. Has asthma. Okay, so first thing, asthma, neurological, adrenal glands. First thing, asthma is the first part of COPD, chronic obstructive pulmonary disease. First phase, you got asthma, emphysema, the actual what they call COPD, which all of them are part of the COPD chain. So you know that. He's got afibrillation, atrial fibrillation, meaning his atrials, which is the top chambers on your heart. The smaller chambers, blood goes in there, all right, first, and then to the ventricles. That atrium is fibrillating. There's flutter and there's fibrillating. Fibrillating is better than fluttering. It depends how many beats, electrical beats. Generally, one beat comes from the sinus SA node, from the atriums, that opens up the mitral valve or tricuspid. Blood then flows down from the atrials to the ventricles. And then you have that movement to the lungs, you get oxygenated, back to the left side, and same thing, and then back to the body again. So this is, again, you see AFib with adrenal glands. Now, here's another thought with AFib, though, is calcium channels. So you want to look at the parathyroid of your dad here. At 84, it wouldn't hurt to pop up his parathyroid gland in the first way. Duodenal ulcer. So you're either looking at a pancreatic problem where he's not producing enough bicarbonate, and these proteins are burning him, or the hydrochloric acid is burning him, or it's interstitial lymphatic constipation, which is the worst one. Remember, we talked about that. If it is the pancreas, first of all, stop all protein on an 84-year-old. And an 84-year-old should never have protein because they're too old to deal with it. The kidneys on these guys are down, prostates are down, all these things are down. They need to live on raw foods as much as possible. Fruits, berries, and melons. Energize the brain, turn on the nervous system, clean the kidneys, prostate, revitalize an 84-year-old. Because at 84, he's got to have some partly good genes. And you can go in and refurbish this 84-year-old man here and fix all these things. Going to the high blood pressure, of course, there's your kidney connection. And, of course, that's going to go back to the asthma with the adrenals and blah, 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 blah. Hyperthyroid. Hyperthyroid had a radioactive isotope years ago. Well, now, is it still hypoactive, or is it now shot, hypo? Where's it at? Check his basal temperatures under the arm. If he's low in the thyroid, get the glandulars, get that thyroid excited about living again, get that lymph moving through that, get the blood moving through that. Upper circulation would be excellent for that. If he's still hyperthyroidism, you have to look at the pituitary. So detoxing, of course, I don't know at 84 where you're going to go with that, but if the guy's interested in it, he can fix himself right up here. Balance problems. So that could be part of the, what? High blood pressure. Could be if it's swinging. High blood pressure 1 minute, normal the next, kind of. At 84, I don't know how normal he could be with that, especially on a typical diet. But we're talking about cerebellum, aren't we? Equilibrium, dizzy problems, cerebellum right here, seat of the parasympathetic side of the autonomic. So balance problems. The lymph, you got a lot of inflammation in the head. Water pill for edema, legs. Kidneys. Kidneys, he's not filtering. He's not filtering. He's highly acidic. Is a nervous worrier disposition. Well, with the adrenals down, there's the autonomic. That can, as it gets weak, he can start getting the shakes, like especially with the cerebellum. He can start to getting the shakes like this, real easy. Has a leaky heart valve. Okay, so here is either the mitral valve or tricuspid. Well, you're going to think parathyroid again. You're also going to think high acidosis in the heart, so you have to worry about congestive heart failure or simply an MI, myocardial infarction, which is simply a heart attack. They said it would need surgery. He takes albuterol to breathe. Now, the problem with albuterols and all these inhalers, cancer-causing, you can't suppress. Use herbal antispasmodics to relax the nerve. That's the nervous system side of this. He's spasming. Get that parathyroid up, because you know there's a parathyroid involvement when he has a thyroid involvement. And so he's had radioactive icicle. Oh, these guys just don't know how to stop. So, with that said, go after that. Here, thin, weak. Okay, so he's probably malabsorbed. Obviously, with the lymph system this bad, it's backed up in the bowel wall, so he's probably malabsorbed, weak, neurologically, real weak probably, and taking a while to recover from surgery. Now, of course, surgery is neurotoxicity. And with already a weakness in the adrenal glands, people have a hard time recovering. Remember that one lady went into type 1 diabetes and she quit menstruating from her forced surgery. Shut down the pituitary gland. Now, has a weak heart valve. Okay, butyrol, digoxin. I've never heard of this one. Diazepam. My mom, Agnes, asked me to send this message about my dad. Well, Paul, thank you, and Agnes, thank you, honey. Get that man, take care of him. Start, bend him over and give him an enema and start with him. But get your dad back there. If he'll do this, he's got some work ahead of him at 84. Sounds like his body's pretty acidic here. So if he has the tenacity to do this, he can do this. But you got to get into, you can use antispasmodics for the lungs. Get away from these inhalers if you have a need to. I would, because they're cancer causing. Why would we want to use a cancer causing treatment for the sake? No, use antispasmodics. That does not block expectoration, because he needs to clean out his lungs and bronchial trunks. With the inhalers, he won't have a chance because it locks everything interstitially. Then you start getting masses from that and blah, 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 blah. I mean, there's nothing ever good said about Arrowbed or albuterol. This is the NORABC. Why you ignore liver most of time? That was a good question. Nah, because everybody thinks the liver's the problem, and I disagree with that. The liver's just an effect like everybody else. The liver's a chemical manufacturing organ. We tend to think the liver's the detoxifying organ of the body, blah, 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 blah. I disagree with that thinking. It's an internal organ that does not eliminate to the outside world. Matter of fact, blood flows through and to the lungs to get oxygenated. It's a chemical manufacturing plant. It transmutates chemistry. When transmutation of chemistry was introduced in the 1900s, chemists just laughed and boo-hooed. I mean, you've got a high amount of intellectual ignorance. So now, when you look at the liver, you start to see biological transmutations. The transmutation of chemistry from one to another, glycogen into sugars, blah, 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 blah. Matter and fact. Let's go back with that. Let's go back to the guy with the melanoma that talks about sugar. If you don't supply sugar to your body, guess what your liver's going to do? It's going to seek fat and break it down into sugar. Because you have to have sugar. You can't get away from it. And if you burn all your fat out of your body, breaking down to sugar, guess what's next? Your structure. Protein is not burned for energy, but if you have to burn a protein, an amino acid, and break it down to a glucose, you're in serious trouble. Now, all the proteolytic enzymes that all of you think is going to break your body down when you fast is really going to break you down. You cannot get away from the essential needs of a cell. Your thinking is off with that. You have to focus on what is the reality of how a cell is damaged or mutated. What does that? Back up from that. Not a disease flying around looking for people to land on. Jeez. That's what 10 years of medical school gives people? I don't think so. I think you got to understand reality here and how creation expresses itself in magnetics and chemistry and how that applies to the health of tissue. And why the two fluids in the human body? What's their job? What are they doing for you? Why the fixation on the blood? When lymph and interstitial fluid is 3/4 of the body's fluid, and it is the dominant side of the acid side. It's where all the pain, inflammation, all the cancers, all of that is. Why would you keep looking at blood when all the problems are in the other system? I don't get it. Hey, Miss Karen Rankin. Please, everyone, be cautious to using the glass droppers. Yeah, I heard about baby cakes. Oh, man. Well, God, sorry about that, but we don't use plastic. I just don't like plastic whatsoever. But with a dog, good point. Could bite down on it, so good point. I didn't even think about that, to tell you the truth. I have a glass bottle, and I use mine. But good point. Excellent point. Okay, I just wanted, this is Sean DJ Frost. Thanks. Thanks for your good comment, Sean. Hello, Doctor. Let me see. I am currently taking several of your herbs, including stomach and bowel number 1, kidney, bladder, brain and nerve 2, lymphatic 1, liver, gallbladder, endocrine gland, and adrenal gland. However, I seem to feel worse on the brain and nerve, endocrine gland, and adrenal formulas. I have tried them by themselves and together. Well, muscle test. Muscle test yourself. Remember, we have the video on muscle testing. Muscle test yourself on these herbs. If your body tests weak on them, don't take them for a while. There's some herb in there maybe your body doesn't like. Strange that all three would. Brain and nerve might, because, boy, you got some of the nature's powerful nerve herbs. But, you know, muscle test each one of those. If you muscle test strong, your body wants them. That's not doing it. If you feel weaker with it, and feel when you hold something, when you pick up an herb, feel the energy from that herb come through you. You can see if your body wants it or doesn't want it. And just get your intuition up there, us guys. The women already have a lot of that. We need to catch up with them. So let your intuition, let your feelings, start feeling things, feeling more energy from things, and seeing more energy of things. You know, it's how we look and where we look that guides our journey. So, you know, do that. And I seem to have worse anxiety on them. Wow, well, come off and go to an adrenal glandular then, and work with that for a little while. Rare to see that, so I would muscle test on those three and see which one's doing it. Hard to say, because the brain, I would suspect maybe brain and nerve could be too much endocrine gland. Maybe just do the endocrine gland for a while. Play with that muscle test. I think you'll find your answer there. I am trying the fruits as well, but they seem to be very, really hard on me. Well, then slow up. You might have a really weakness in these areas. Slow up then. And try to do the fruit for breakfast. Get that lymph and kidney flushed for the morning, and then do vegetables the rest of the day with some green drinks, and work yourself slower to this. There's no sin or crime in that whatsoever. Some of us have to do that. Me, I did salads first and kind of jumped into the fruits, but my body could tolerate, wanted it. But some people have a hard time working that. And it's just a deeper level of detox. So go slower then, man. You don't have to really tear it apart right off. I do know you have adrenal weakness. Also know that I have pituitary weakness because I have, albinism. I tell you what then, slow up and just do the endocrine gland formula and see how that is. Because it could be overstimulating the pituitary or something. And that would be pituitary. You're right on with that. So go slower. Give me a picture of your eyes if you want. We'll take a look at that. But I would go slower. Maybe take your dosage way on down there. Just have to see where you are with that, and work it out. Go low on dosages, muscle test. Maybe just get those off and do a pituitary glandular. That'll trip up your adrenals a little bit, and see how you work with that. But you were right on there. You guys are really smart, I'll tell you. I know a lot of you are struggling to get through this, but always muscle test. Someday one formula will be good for you, and there'll be a day where that formula body doesn't want it for a while, and you're going to change to something else. That's why I change people's protocols every couple of months, just so the body can introduce to a new level of thinking with the herbs, different herbs and stuff. However, I do go to bed at a decent time. I just can't sleep and roll over all night. Well, that sounds like the pineal's involved too. When your pituitary's involved, as a rule, not always, but as a rule, your pineal is involved, and that's your gland of sleep. So that could be what you're seeing here. My anxiety has been on and off for most of my life, but extreme in the last 5 years. Well, you also could have a lot of neurotoxicity, my friend. So you don't know where you've been, what foods, what pesticides, or what chemicals. So you want to detox. I suggest in listening to you that you go with vegetables and green drinks for a while. Try to keep the fruits in the morning. Try a glandular for the pituitary, but start out real low. I'd also do a glandular for the adrenals. Muscle test everything first on you because it sounds like you're a sensitive kind of guy. So you want to just muscle test, go lower on your dosages at first and work yourself up. No crime in that at all. Some people are just real sensitive. Other people just suck that stuff down. I'm kind of in between, the sensitive and the suck down. I can be real sensitive, but then I can suck some stuff down. I do know the more neurologically weak you are, the more you have a difficult time with that. When I poisoned myself, I went down. And I can tell you, I've been sensitive to herbs ever since. But now I'm back and I can bring them on down. I do not know if this is a hyper or hypo condition. I'm suspecting hypo, but you could have one gland hyper and another one hypo, definitely. So you might have a little combination. You might see some swinging too. And that would be more inflammation or acidosis. When you see swinging, hypo, or bradytachy, or heart speeding up and then slowing down, all these things, there's a stimulant involved. Whether it's acidosis, inflammation, chemical, there's a stimulant involved. So sometimes if you have a hard time detoxing fast, slow up. Slow up and go slower at first, get your green drinks down, kind of go that way, and then just keep building and building. Same thing with the dosages on the herbs. Slow down if you have to, absolutely. Could be the alcohol in them too. So we've got these new glycerin infused coming in. I think they'll be here this week, or certainly early next week. I feel that I need the glandulars but can't get them because I have not gotten my appointment yet. You know what? I'm going to take care of that right now. I want you to get the glandulars. I'm going to tell the girls back here, free those babies up for people that want them. I'm going to tell you that right now. And so you guys go ahead and order your glandulars, and I'll free that up right now when I leave this video. Because I need you to work on yourself and do it appropriately. Need to know what I can take or do for extreme anxiety. Well, try these glandulars. Go ahead and order them in, man. And say, I told you so on YouTube if anybody gives you any crap over it. What bulk herbs would help? Well, you can even go slower by using the Heal All tea a little bit. and go slow that way, slowly moving things through. But if you got big time anxiety and you have the albinism, then you really want to get into that pituitary, even if you start real slow. Now you know that it's going to be the colon involved as well, so you want to get to that bowel work. Try the GI broom, get your bowels opened up, get your kidneys and adrenals. With that adrenal, high anxiety like that, either real weak adrenals, neurotoxicity of some sort, that sort of thing. A really dark place trying to control this. Well, you know what? Get yourself an appointment up here with me or Marcy. Fill you out a questionnaire. Give me a picture of your eyes, and let's get you balanced out there where we can work with you one-to-one and go, move you down this road, okay? Please, if you can help in any way, absolutely I'll help in any way. You can, always, man. I'll help all of you guys. Are you kidding? Now, my time is a little... Casey, you want me to answer this on YouTube? Well, but that's common in men. And I think that this question that you have, Casey, I think that you go after the health of the prostate, you go after the health of the kidneys, check your parathyroid gland because that augments structure, and work on it that way. Get your adrenals up, of course. It's tough to stay just fruits because my nervous system feels jittery and unbalanced when I do so. Well, come back on some vegetables then. Balance yourself out a little bit there with the green drinks and stuff, and give yourself a nice balance, because you see that some people just can't get up there on the fruits. They're just that strong. So there's no sin in slowing down a little bit. Not at all, guys. I'm just a pedal to the metal kind of guy because everybody's hurting so much. We just, and as you see, some people take a long time to start filtering as it is. So it's scary out there. You guys are really fighting for your health, and a lot of you are winning, and a lot of you are moving toward that, and I'm real proud of every one of you. Sometimes we know things that it's just a process to get involved with and a process to accomplish. Don't let that warp the fact that this is truth. Don't go get frustrated and run back to something that is going to make you be worse. Just realize that time. And some of you with genetic weaknesses, it could take a couple of years or more. Don't get upset with that, because you're talking about the genetic memories of cells. We're going to show you guys in the class how genetic lesions can shrink and almost disappear through diet and stuff, herbs and stuff. So, look at your parathyroid, Casey, and lower circulation would also help. Check that parathyroid, and again, get the kidneys and adrenals up, and I think things will straighten out. There's one here that just tons of questions. And I only wanted to go through it because some of these questions are pretty good for everybody, but there's just so many of them. So, Ella, maybe this will help you guys here. Okay. Yeah. Hi, Ella. Pretty young girl, pretty woman here. She's South Florida. She's a 38-year-old female and was always very conscious, obsessed about health since she was 13. I think I read some of this yesterday on the thing. At that time, back in Lithuania, I read some of this yesterday. But she has just a world of questions here. Let's see, 15 years vegetarian, water fasting, sports, all kinds of vitamins and supplements and stuff like that. But nothing helped me with my constant fatigue and depression. Well, I think we talked about this. The fatigue obviously is going to be your adrenal glands. The depression is going to be your parathyroid. Now, with that said, do we have female problems there? You got a beautiful young daughter, but do you have female problems? Are your menses on time every time? Is it irregular? Do you have heavy bleeding? That would take us up to your pituitary gland. You can't ever forget the pituitary gland. And with the pituitary gland, it takes us then back down to the bowels. See, I'm drawing these pictures, but we wouldn't know these connective links if it wasn't for iridology. So people can boo-hoo iridology all they want. I love it. Incredible science. Simple one, too. Everybody can learn it. You know, the big guys don't want all you guys to know a lot of these little secrets, don't they? She was consuming a lot of sweets and breads. Let me see here. After my daughter came to life, I am having sleep problems. Also, I am getting skin conditions from time to time. Well, what's happening is your kidneys are getting weaker over time. Your adrenals are going down more over time. And, I mean, you're a health nut. But, you know, sometimes we can eat healthy, which means raw, and still not get much better. That's why I say when you take off the vegetables and go to the fruits, it takes you deeper into this world. That's also, you bring in the help, you bring in our friends, you bring in the herbs. And they come in and sit down and go, all right, let's get busy. Let's go take care of some business. And they go in and they start working on you. So that's why I found through the years that a nice herbal protocol along with a raw food diet, you're on the top of the mountain, baby. Nothing can beat that. There isn't anything can beat that. Homeopathics, nothing beats that level. You're at the top level. It's just a matter of time and a matter of your consciousness. That's why opening your consciousness and controlling the mind instead of it controlling you. Live out of your mind and you'll see the answers of life. Get into the mind. It's a totally conditioned instrument. It only works from conditioned thoughts and thinking. Doesn't have any basis in reality per se. It's part of the drama. And the drama can be anything you want to make it. But the skin condition just tells me just that you're backing up. You're not filtering in the kidneys like you should. Let me see. I was immersed into some kind of new interest or socializing with friends. Otherwise, just feel like waste. With years, I find myself even less interested in social events. Friends, well, you do. I'm a recluse, no question about it. I am a total recluse after spending all my day, and then I'm at home with all these charts. So I'm just real private, quiet. I'm also tired, looking for answers. Of course, food is very important, but isn't there is more to life than that? Obsessing over diet. Well, that's an excellent point. I'll be honest with you. That's what happened to me. And Dan McDonald the same way. A lot of people saying we just tore things up, and then we needed to take a break and find balance a little bit because we got unbalanced because we weren't born this way. And so we had to remember balance. The cells needed to catch up because you have 100 trillion little people in your body. They also are connected to your consciousness. And as you grow, they have to grow with you. So this is a big deal, and we're going to talk a lot about that in class. So, yeah, I don't want people to obsess. That's why I'm hoping that truth will resonate with you to the point that, okay, I got it, and then just go out and do it. Don't give it another thought. Don't freak over it, because what happened to me is I got feeling every little thing in my body. I could feel the blood flow. I could feel every little thing in my body. And I had to get away from my body because it was like, oh my God, what's that? And I had to get away from that because I was too body conscious. And that's a good point that you bring up. That's why I'm reading your thing here, because you really brought up some good things, and you have to get away from this body consciousness. Absolutely, dear. Absolutely. Boring. The God worlds, that's another thing. You'll never use the word boring. Matter of fact, you might say, stop, I need a break. Your program is my hope. It will, sweetheart, to get you back, honey. This is nature's program, not mine. I just put all the pieces of the puzzle together. Nature has the puzzle pieces. We're just putting it together in a more of an appropriate way, you know, more of a realistic and truthful way. And I have a beautiful daughter. I see that. She is a beautiful daughter. Not to mention I would love to have more kids, but where to find that strength to go through the day? Well, again, you know, not only emotionally here, but remember the calcium. Make sure you didn't have any postpartum depression or anything else with that. She's a massage therapist. I just ordered I have strong cravings for bread, and we talked about that. My daughter is 1.5 years old. I think I went over this whole letter maybe. Was sick only once with virus. but she is a bad sleeper since day one. Well, this is something you want to look at, sweetheart, because she could have a lot going on in the lymph system in her head, like mommy, and even in her bowels. You want to get it out and get a magnifying glass and a flashlight and look into her eyes and see what you see. I just put up a bunch of eyes up there. I think Chris has got it up now for you. There's a lot of eyes there to help you to take a look at that. I went through hell the first year, and now she sleeps better, but she awakes almost every night and can't fall asleep an hour and a half. You might have to give her just a little flick of a pineal gland substance, just a little piece, little bitty piece, and see if that'll help her out. But then again, you know that you want to get up in this head area and start cleaning it out. Well, it sits on top of the bowels, so you got to clean the bowels out. Well, now you got the kidneys involved, and they need to be cleaned too. And of course, it's your daughter at this age, she's going to have big-time kidney and adrenals. Look at mom. Mom's already had big-time adrenals. She's so tired all the time. Well, this poor little girl's probably not going to have enough energy to get her head up off the pillow. Make sure the blood pressure gets closer up to 120, but I think you're going to find your daughter being in the 80s to 90s. You might even be to the 90s over when you get your kidneys fixed, blood pressure-wise. That's real low neurotransmitters and real low nerve response, autonomically speaking. Another thing, she is a poor eater too, very picky, and just exhaust myself trying to make something she would eat. Well, I don't know what to say about that. I make my kids eat what I put out there, and I put out a lot of fruit. My son was raised a fruitarian up until he was about 6, and then he wanted salads, so I got him salads. And then when he was about 12 or 13, he got to staying overnight and eating dead animals, and now he's back to eating healthy again, but he's 33. Fruit sounds easy, but what if she doesn't eat them? Then she's going to go hungry. She would take a couple slices of some fruits, but that is not enough. She is not interested in smoothies, purees at all. She would eat bread. Yeah, she's full of fungus like mom. That's all I can say, and you got to defungal her. You know, a little parasite M again. You know, go after her. Don't be afraid of the herbs with the babies. Jennifer's baby's only a few months old. My baby's a few months old, grandbabies. No shocker, right? No shocker. You're right on. I was breastfeeding her till she was 1. Well, there you go. Then she went on cows. Oh, yeah. I read this yesterday. Her dad, 79 years old. He is in the bed for the last 3 years with Alzheimer's. Okay, so I didn't read this one. So, okay, Alzheimer's dementia, all right? What's causing that? What side of chemistry do you think that one's on, of course? And what's breaking down the brain cells? Okay, so we're back to acids again. We're back to the lymph system again. So with him, you'd use brain and nerve number 1 or 2. You'd use upper circulation. Then you'd go after the kidneys, baby. After the kidneys and adrenals. He's your dad, so you might have to consider him with the same problem. Either your mom or your dad has pituitary, parathyroid, bowels, all of those sort of things. And it's likely your dad here is one of them. My dad was a disciplined man. Health and sport was his priority. Never missed a day without jogging and exercising. All our family had to. In his youth, he ate everything, meat, fatty soups, etc. But the last 20 years of his life, he was mostly vegetarian. My influence. Every day eating lots of veggies, focusing on being light, garlic every night. Now, you really want to hit the fruits because vegetables aren't enough to turn on this man's brain. I can tell you right now. We do it all the time here. You're seeing these spinal injuries and neural conditions rebuilding themselves. So understand they're doing it on fruits. They're not doing it. This young man that's a paraplegic now getting out of the chair didn't do it on vegetables. He's doing it on fruits, berries, and melons and the herbs. And that's what your dad has to go the same way. Rebuild the neurological system, but you have to get rid of what's breaking it down. That's going to be the lymph and the acid side of chemistry. Remember that. I don't know that is very healthy though. When his health started deteriorating 5 years ago, we didn't know what was happening. He couldn't get to the bathroom soon enough. By the time he realized he had to go, it was always too late. Is that urine or stool? He had a hard time to finish his sentences, was confused. Right then, it should have worked on him. And he could live 120 years old. See, that's the illusion. Someone asked me one time about people that, how come people that eat bad live long? And no, and this is another example of that right here. So you got to get up and do those things. Nevertheless, here he is in the bed, not talking, not moving. Can he eat? If he can't eat, well, through the mouth, get a feeding tube in him and go up and really hit him hard. Get him on the herbs, honey. Get him on the fruits, berries, and melons. Forget all the vegetables. Forget all that stuff. Get all that done. But the hardest time is to go to the bathroom himself. My mom would give him some Cinna-T every 4 days. Needs to move his bowels every day. Get on the stomach and bowel formulas, getting to move his bowels, because right there is telling me colon problems. But it also links over to the adrenals. Adrenals are so weak, probably low neurotransmitters, not enough to turn on that nervous system, and not enough to turn on peristalsis. So now you've got that. So you always go into the adrenals and kidneys anyway. You're going to go into the bowels. You want to move it every day. So get on, say, number 5. And then after he gets moving really, really good, get the GI broom, clean him out. You're bringing up his nervous system, neurotransmitters with the adrenal glands, and then reach up here. Start pulling and cleaning these acids out of his body. Get up there with upper circulation of brain and nerve, and you'll start opening them up. I pulled a man out of a nursing home with these problems one time. Took me 7 months, but I had him home for Christmas playing with his grandkids, and he was in bed, didn't speak, didn't talk for 2 years. So go after that, and you'll get your dad back. Now, when you know the situation, can tell you that there's a yeah. I'll call in here, sweetheart, and we'll help you there, okay? But do those things. You got a beautiful daughter there, nice blue eyes. This is the same thing. A lot of little questions here, sweetheart, and I'm going to go through these real quick, and then we're going to end with this. But these are a lot of little questions that can be answered here. But I thought I'd answer them on this video because these are questions that one should assume, but also one should know. And read books, especially books that are about raw foods, like the natural hygienic books of Shelton, Tilden, Fry, all these things like that. Arnold Ehret. Start getting in people that are in with the raw and understand that. About food combinations, many raw books say that fruits have to be eaten alone, but then in the following recipes, green salads with vegetables are mixed with fruit dressings, etc., etc., etc. Okay, this is a good question. Also, our green smoothies have apples and bananas and stuff in them. I say this: do not combine fruits and vegetables at the same meal, period. One exception. And that is if you've combined your foods wrong, you've got acid reflux, you're not digesting well here, use an apple. Always keep apples in your refrigerator for improved digestion. And I don't care, you can put them on top of protein, you can put them on top of anything. God made the apple, the original fruit to some, a heck of a food. And it is a great digester, great enzymes. So apples are the only exception to the rule here, in my opinion, but you still don't want to do too much of that. Matter of fact, if you have to sweeten up your smoothies, then obviously these foods aren't fit for man, because man doesn't deal with foods that don't taste good. Notice that? All animals, if food doesn't taste good, they don't eat it and go on to something that tastes good. So I'm just saying that get more fruits, berries, and melons than your greens and things like that. But with that said, these are people that write recipes. They're wrong. You know, it might taste good, but you don't combine bananas and all these fruits with salads. There's no way. Or you'll get fermentation. Then you'll get gassy, bloaty, belching, passing gas. Not the way of things at all. Two of the most important combinations you can remember is never combine protein and starch together. That's acid with base. They neutralize each other. Your food will just feel like it's sitting here not digesting. Kind of like your pancreas sitting there going, what do you want me to do about it? And you see that, and that's been always the question, mixing hydrochloric acid in digestive enzymes, which are basically base. And so, you know, always problems come. Of course, they don't recommend digestive enzymes. Eat an apple. Eat your foods raw. If your foods are hard to digest raw, then go to the fruits, berries, and melons, because vegetables are hard to digest for even herbivores. That's why the multiple stomachs, the grinders, and the long intestinal tract. When the body's cleaned up, does it take better and proper food combinations? Hell no. Matter of fact, when your body cleans up, your food combinations is going to kick you upside the head. That's when you really feel them. I had some lady one day, she had a salad. She put thick, some kind of, and it was either, it was milky, so it had to be like ranch or something, thick over the salad, and then she had fruit on top of that. So I'm thinking, I'm glad I'm not going home with that lady. And I looked at her and I said, oh, a little dressing with your salad? Or a little salad with your dressing? Can fruit be combined with coconut? Yes. So the melons have to be eaten alone from other fruits as well. Not necessarily, but it's a good idea to get in the practice of always eating your melons alone. I have combined cantaloupe with bananas because it tastes so good, but it is better to have your fast digesting foods go down first, because protein and starch, no, and fast digesting foods go first before slow digesting. Imagine slow digesting foods, and we've talked about this on other videos. And I told you a case where a man was arrested for DUI by simply putting watermelon on top of oatmeal. You do not do that. You're going to get alcohol levels soaring in your blood, and you're going to get blood sugar levels soaring. And if you're a diabetic, you definitely want to watch your food combinations. So always eat things alone. In between the fruits digest the fastest. So you can wait shorter times before you have the salads. If you have a big salad, you have to wait longer times to have your fruit. You want to make sure you feel like your food is out of your stomach at least an hour or so. Less time with your fruits and less time even with your melons. And you'll feel when it's out, not digest, it's through the stomach and down in your intestines. How soon can I eat fruits after I eat a salad? At least an hour to hour and a half. Are you against any cooked tomatoes? Absolutely. Can I eat fruits before I go to bed if I am still hungry? Absolutely. But fruits are good because they create less digestion, less neurological disturbances, enhances the neurological system. What selling dressings are you are using? Now, all these questions are simple and should be common sense, but I'm reading them off, so hopefully, you know, the staff has a video. They can say, go listen to that video. All I say with salad dressings is nothing creamy or milky. Go to the health food store if you're going to use anything with vinegars, and use apple cider vinegars instead of distilled vinegar. They're all acidic, but distilled vinegar really leaches calcium out of the human body. What do we need oils? I don't go crazy over oils myself. Everything has fatty acids in them, and that's what you're looking for is fatty acids, like you're looking for simple sugars and amino acids. Remember the differences. And so a little flaxseed oil, hemp seed oil, okay. So what? A little bit's okay. Have some coconut oil. But don't start doing a lot of oils, because now you'll stress the liver and gallbladder. Remember the other day I was telling you that if you do too many oils, you spasm your liver and gallbladder. That's how you get the stones out as it is. You spasm it. If I can't get organic berries, is it better not to get them at all? Heck no. Get a veggie wash and wash everything. It's like, well, listen, I can't get organic, so I'm just going to go ahead and have my meat and my starches. Come on. Wash them and use a veggie wash. You mentioned sprouts are good, even bean and grain sprouts. Alfalfa, alfalfa, alfalfa. Mung bean is very common, but alfalfa is your best. A lot of people sprout sunflower and everything else. Go on, I don't care. But if you're going to do salads, get to the alfalfa. Man, you got a good, powerful plant. Make sure they're really green. What is the best from bad food? In those cases, when you feel that you have to step back to slow down for balance, and this is a good question, or when detox is over, or attending a party, are grains better than animal products? Absolutely. Absolutely. Hands down. Is fish better than eggs? I'm not going to say that. I'm going to say eggs are better than fish and do them raw. Is potato better than corn? No, I'm going to disagree. I'm going to say corn is better than potato because neither one of them is worth a crap, and corn doesn't digest anyway, so it's just for flavor, and you don't have to worry about the side effect of it. With the exception of a baked sweet potato, you could do that. It's okay. Baked sweet potato would be better than the two. Are spices okay? Yep, all kinds of spices. Love them all. They're part of nature's beauty, smells, taste, part of what also can bring you into balances. But vegetable soups, things like that, cooked vegetables at parties, stuff like that. Always look for your veggies first instead of your meat things. You know, again, I agree with you with the grains are better than the meats. But at the same time, if you get into white flour over fish, I don't know. They're both real bad. So I don't know what to say. White flour is probably worse. I don't know. You got all the putrefaction and the dead tissue and all of the urine and stuff from the meat. So maybe the bread would be better. Hard to say, guys. What about store-bought almond milk, coconut milk? Again, store-bought. It'd be better to make your own. Well, the coconut milk is a fad, and so is the almond milk, so you're getting some good sources. I'll say this. My God, you look at these cartons and they have aluminum foil like inside and stuff. You got to be real careful about aluminum products where they come into contact and they have these chemicals that protect it. I mean, I don't know what to say. I'm not good at buying things that are not in glass. I'm just not good with that. I don't do that. What is your opinion? You can get coconut milk in glass now, so I would do that. Almond milk, what are you drinking it for? You don't need it. Why do we use milk and think milk at any level is good for you? Whether it's almond milk, rice milk, who cares? Soy milk, it's all crap. Soy being the worst, of course, but it's all crap. What do we need it for? If you're going to use a smoothie, use fruit juice as your base. Don't use a milk as your base. That's not a true smoothie to use milk as a base. Milk meaning coconut milk, almond milk, or anything like that. You can put coconut milk from the coconut. What is your opinion on Hilda's clock, the cure for all diseases? Bioelectronics program zapper. I don't have anything to say about her. She's from my hometown. I can only tell you that, she brought the awareness up a little bit, but look at what she recommends for diets and stuff. It sucked. The zapper, what are you trying to kill? If you believe in microbes causing cancer, then you're no better than the medical profession. It's one thing to deworm a person and get the fungus out of a person, but if you're blaming pathogens for man's problems, I think that's part of the problem. And this is Jenner Pasteur theories. Those theories really don't hold any water, really. But we still have it. The fear has caused all the irradiation things. The fear has caused all the spraying. This fear, you wear a mask and you're always washing your hands. I say take those people, throw them on a farm and let them get natural immunity, and then they don't have to worry about it, and clean their terrain out, their culturing medium, your lymph systems. Absolutely. I gotta go. But don't think you're going to kill your bacteria out of your body and you're going to be healthy and happy from that, because you're going to be the opposite. You never kill the bacteria out of your body. That's a problem. A lot of people are putting more in. So you got to get away with that kind of thinking. If you have fungal problems, go to the herbs. Go to, not Hilda Clark, but where's the other lady? Of course, she passed too, but she had a hell of a deworming program. I did hers for a while. Her name doesn't come to my thing. What is your take on Weston A. Price's work? Not good. I don't consider them very smart at all, to be honest with you. No offense to them. But if you are not at this level, forget it. And this is a supplement freak, people, stuff like this. I'm not into that. Whey protein stuff, I'm not into any of that. Sorry, I'm just not into that. You know what causes degeneration? It's easy. There's only two sides of chemistry, and what foods are good for you. You know what you have to do. You know about the herbs. People need to get in the herbs. Once the price needs to get in the herbs, get a little higher thinking. Why cooking dense vegetables and greens destroys everything valuable, but making tea of delicate herbs does not. No, I didn't say it does not. It does destroy anything water soluble, even the herbs. So, but the teas, that the medicinal values come out of here and really help the person, probably more the oils. And so, generally as a rule, you don't overcook your flowers and your leaves. Matter of fact, you really just want to steam them. You only really cook the roots to get out those more oil solubles, more the alkaloids and things like that. Your flavonoids are more in the berries and leaves. So when you have a formula that's got a cross of them, like the Heal All Tea, it's a little bit difficult. But notice, even when you cook the Heal All Tea, it's powerful. But with the vegetables, they don't have a lot of healing properties in them to begin with. So I don't know what to say about that. But it's a good question. You're always stressing the importance of kidneys and adrenals in every case. Why adrenal herbs aren't present in your detox kits before weeks 5 and 6? They are. Endocrine gland formula. Endocrine gland formula has all of them. To tell you the truth, that's why I write specific protocols for people because I put them on the glandulars almost right off. I do the first 2 weeks and then I have you on glandulars because we have chronic glands. So it's different when you see us or go through this than our protocols. We're real careful in our protocols because we're trying to help everyone. So we're real cautious. So the endocrine gland formula, real balanced formula, really good for that. Pops up the adrenals, the pituitary, the thyroid, parathyroid, all of that together. And herb-wise, that's about the best we know. But that's the only reason, to tell you the truth. I cannot wait for your video, but love to you too, dear one. And thanks for the questions. I thought they were good questions. I thought everybody needed to hear my take on them, but there's so many questions out there. Just use common sense. You know, I had one lady, she had gnarly fingers like this, extreme arthritis, an organ player at her church. Her skin was all wrinkled. Well, I went after that lady. 3.5 months later, her fingers are straight, but one. Still a little crooked, but all of them, the rest of them are all straight. Her wrinkles, she had one big wrinkle left. It looked like a clown, but all this was straight, and she made the front page of the newspaper when they were interviewing on a cancer case. She was sitting there going, look, my fingers are straight now. That's the power of nature and God, man, and that's exactly what you guys are doing, and love to you all. And you just keep on going, guys. And sorry I had to go a little fast, but I wanted to get through this as much. I've got to run, but it's been an extreme pleasure. I have had nothing but extreme pleasure working with each and every one of you. Always keep your common sense. If you don't know, ask. But keep it simple. You know, keep it simple. Keep everything in food combinations. Keep in mind, the simpler you eat, the better the digestive power. So that's why more mono eating. You don't. I saw one orangutan once gather 2 different fruits at one meal. But most of what I've seen in the animal kingdom is mono eating. And even though you can change it up per meal, you digest better the simpler you eat. Just keep that in mind. Everything has its own consciousness, its own patterns, its own amino acid patterns, its own sugar patterns. All these patterns are different in its digestive needs. So the simpler you live, the simpler you are, the simpler you eat, the happier you'll be. And then that love will start coming out there. So open your hearts, and here's a big hug to each and every one of you. And have fun on this journey. Don't make it complicated. Have fun. Bye-bye.